3 tips for employers looking at how to expand or what to offer when it comes to gender-related wellbeing benefits. I think the first would be interrogate your data. You know your workforce better than anyone else, so look at your people data, look at the demographics of your staff, look at your sickness data or the PMI data, your claims data. And what does that tell you about who you have in your business and their needs? Consider those life events and the health events that those people might be facing. If you've got a particularly male-dominated workforce, then of course there are benefits that might be more appropriate for them. And we know that particularly around cardiovascular disease and access to men is a challenge. And if you're trying to achieve that gender balance, get more women into the workforce, then there are certainly benefits that are more attractive than, for example, menopause benefits. Secondly, I think, take stock of what you've already got. We're in a world where finances matter, purse strings can be a little bit tight, and actually you want to, with your budget, you want to do the most for the most. So actually consider what you've already got in place and whether they're still fit for purpose. Are they accessible? Are they used? Or whether perhaps they need to be relaunched. So when considering healthcare benefits to support a gender balanced workforce, don't exclusively think of female-only health concerns, for example. There are several benefits that actually could be disproportionately useful or accessible for women, but that can also support males in the workforce. And I think if you're looking to do something with that restricted budget, those benefits might be appealing. So for example, neurodiversity. We know that women have historically been recognised much later in life than men when it comes to neurodivergent conditions. And in fact, there is data that suggests they are on average diagnosed in their 40s compared to men who are diagnosed at school. And that can absolutely be having an impact on their progression in the workplace and their finding the appropriate role for them and really getting stuck into enjoying their career. But offering a benefit that will give them access to a diagnosis for a neurodivergent condition would be really, really beneficial for them. I think fertility benefits would be another example of that, historically grouped into women's health, perhaps because the woman goes through much of that journey themselves, but also absolutely valuable for men. That drive and desire to have a family is certainly across both genders, and something, again, to the point I touched on earlier, where perhaps it's not very well supported by the NHS. And then thirdly, I think, leverage your staff. I certainly found that employers who make a real effort to use passionate employees, to engage with employee resource groups, to fund those and support them, to have maximum impact, get greater traction when releasing wellbeing benefits. Establish and support those groups, find senior sponsors to be engaged with them or advocates who will talk about their own experiences, breaking down the stigma, because many of these gender-related wellbeing benefits are actually ones that historically we haven't talked about. Menopause, fertility, men's mental health. And if we can get people openly talking about it, as you would a sore throat or back pain, I really think will make a difference. I think hearing familiar colleagues engage, hearing senior colleagues talk openly about these subjects are incredibly important. Having the benefits there is one thing, getting people to engage with this